cancer affects many American lives on a yearly basis, but more specifically, 29,740 men are affected yearly in the U.S. alone. My article is titled Prostate Cancer, Risk Factors, Diagnoses, and Treatment, which was published August 9, 2010 by Bruce Turner and Lawrence Drudge Coates. Bruce Turner and Lawrence Drudge Coates are urological oncologists who are currently practicing in London, England. I chose my article based on my bloodline because I currently have family members undergoing prostate cancer, and I'd like to further my knowledge on the subject of prostate cancer. The author's thesis of this article is to provide a good understanding of prostate cancer, its risk factors, diagnoses, and treatment options, which are also the points that I would like to discuss with you today, being risk factors, diagnosing options, and treatment/managing options. The first point which I'd like to share with you are risk factors. Although there are many risk factors out there, and most of which are not fully understood in today's medical society, a couple of them are, and which I would like to share with you, are family history and geography. Family history is important in that if certain families have a history, so as to say, of people having prostate cancer, and prostate cancer being deemed a genetic disease, family history is important to me in that I currently have family members undergoing prostate cancer, and should be important to nurses and doctors everywhere to take effective family histories to pick up on early signs of prostate cancer and maybe prevent future cases by doing so. The second risk factor, being geography, is important in such that certain geographical locations have a tendency to have higher and or lower rates of prostate cancer, such as Asian men and people of Asian descent tend to have the lowest incidence of prostate cancer, while African American men tend to have the highest rate of prostate cancer. The second point which I'd like to bring with you today is diagnosing options. Although there are many diagnosing options, several of which are prostate biopsy and PSA testing. Prostate biopsy is simply taking histological samples or skin samples and giving them to lab technicians, and letting the lab technicians run tests on these histological samples to see if you test positive or negative for prostate cancer. This is also termed a very effective way for diagnosing. PSA testing, if done by itself, is deemed very ineffective, but combined with any other number of diagnosing treatments, is considered very effective. And because of PSA testing, nurses and doctors are able to catch prostate cancer as far as early as up to 9 years earlier than before pre-PSA testing periods. The third point which I'd like to share with you today are management and treatment options. Like before, there are many management treatment options, some of which are surgery, radiotherapy, and chirotherapy. Surgery is one of the most effective ways to treat prostate cancer, more specifically radial prostatectomy, which is very effective and done on patients with localized forms of prostate cancer. Radiotherapy, which is also deemed very effective, is given to patients who have a more advanced and a localized form of prostate cancer. And the third type of treatment would be cryotherapy. Now, although cryotherapy is termed a new form of treatment and managing option, it is basically the freezing of cancer. It has achieved very positive short-term effects for its testing, but the long-term effects of cryotherapy are inconclusive, being that it's such a new form of therapy. This article discusses risk factors, diagnosing options, and management/treating options for prostate cancer. I believe that the article did an excellent job in giving general information and in-depth information on the subject of prostate cancer, and I would greatly recommend this article to anyone who would also like to